Hi, good morning, everyone, and thank you so much for joining us today on how you can learn how to use the COYL Toolkit in your community to support advanced care planning for your residents. My name is Katie Bisaha, and I'm a Community Health and Policy Associate at the New Jersey Healthcare Quality Institute. And just to kind of give you a quick overview of my organization, the Quality Institute's mission is to improve the safety, quality, and affordability of healthcare for everyone. And we envision a world where all people receive safe, equitable, and affordable healthcare and live their healthiest lives. We're a nonpartisan, nonprofit organization that works with our multifaceted members to improve healthcare. And our work includes our community health work, and that consists of our Mayor's Wellness Campaign. And the Mayor's Wellness Campaign, or MWC, gives mayors and community leaders evidence-based tools and guidance to improve the health and wellness of their communities so that they can help their residents live their healthiest lives. And COYL is an initiative of the Mayor's Wellness Campaign. So just today, we're going to review the importance of advanced care planning, what the COYL initiative is, and how COYL connects to healthy aging, and how to utilize that COYL toolkit in your community. So just starting off with like a quick overview of what advanced care planning is, it's a process of making decisions about future healthcare preferences in case a person becomes unable to make their own decision. And this lets us discuss our values, goals, and treatment options with those who matter most to us, our healthcare proxy, and our healthcare team. And in 2019, the Massachusetts Coalition for Serious Illness did groundbreaking research about why people do and do not engage in advanced care planning. And what they ended up learning is that people are very aware of advanced care planning, but 2/3 had a reason for why they didn't want to or they felt they didn't need to. And two of those major reasons were identified as they didn't trust their healthcare system would follow through with their wishes. And they also believed that their doctors, family members, really their proxies, would magically know what they had wanted, which meant that we needed to kind of shift our focus from telling them what advanced care planning was and instead how we can empower them to make those decisions and have those discussions. And so COYL, or Conversation of Your Life, it was launched in 2014, and it's an initiative of that Mayor's Wellness Campaign. And we aim to provide communities throughout New Jersey with resources, educational programs, and connections to subject matter experts and speakers on how advanced care planning is an essential part of health and wellness. So really, we aim to empower residents to discuss, document, and share their healthcare priorities with the people that matter most to them, their proxy, their provider, to ensure that their voices are heard in case they can't speak for themselves due to a medical emergency or a serious illness. And so, keeping in mind that statistic that 80% of individuals are aware of advanced care planning, but 66% had a reason for why they didn't want to or need to, in 2022, we embarked on updating our COYL initiative to reflect these revelations about advanced care planning. So our goal was to create a user-friendly, community health-focused toolkit tailored for mayors and community leaders to provide awareness and understanding of the importance of advanced care planning for New Jersey residents, and then also overhauling our workshops and initiatives and collaborations with subject matter experts and resources to create ease of access for our COYL partners, and then update our COYL partner network to gain people power for the COYL initiative. So we're going to take a little bit of a dive into our toolkit now, which is the bulk of our work, and review those tools available to you in your community to create awareness and education. So the first section introduces you to a toolkit as well as provides basic information about COYL and the key terms at the heart of it. It also describes the purpose of the toolkit, which is to serve as a comprehensive resource to promote advanced care planning and healthy aging within communities throughout New Jersey. And this toolkit will help communities and community leaders to engage residents on this important topic, as well as empower those residents with information needed to make informed decision about their healthcare preferences. And section two of the toolkit focuses on healthy aging and how COYL does align with it. We all know we're going to age. It's really a fact of life. It's pretty much the whole focus of this entire summit. And we also know that we're focused in New Jersey on healthy aging and aging well. And part of aging well is planning for our future, and that includes our healthcare priorities. So this section will actually review what healthy aging is for those unfamiliar with it. And then it'll be followed by how COYL aligns directly with it. And so having a COYL initiative in your community can help help support healthy aging by creating open dialogue and social conversations and connections, furthering personal empowerment and autonomy, reducing anxiety and promoting resilience, and incorporating COYL into these initiatives strengthens communities' commitment to supporting individuals throughout their aging journey and ensuring their voices are heard, their choices are respected, and overall well-being is enhanced. Now, section 3 is probably the bulk of this toolkit, and it centers on how to successfully launch COYL in your community. So we walk you through several steps that you can take to do so. So if your municipality already has a mayor's wellness campaign, we definitely encourage you to work closely with them, as these communities across the state provide access to healthcare services, physical health interventions, social cohesion activities, mental health initiatives, nutrition and education through those local mayor's wellness campaigns. And so you can use that framework to also address healthy aging and advanced care planning in your community. If you have a mayor's wellness campaign, we also encourage you to become a COYL advocate on your local committee, as you can advocate for the inclusion of healthy aging discussions in your local mayor's wellness campaign programming and assessments. So you would be a champion for those crucial conversations and making a positive impact on the health and wellness in your community. And our toolkit has more information on how to do that. And QI staff like myself can connect you to either your mayor's wellness campaign or vice versa. An assessment is a crucial step in ensuring that your mayor's wellness campaign or community is addressing your community's health and wellness needs. So in this section, you'll also see a COYL needs assessment, which encourages adding questions about advanced care planning and resources to support residents as they age and face new health challenges. The toolkit also includes several workshop options that QI staff can connect you with subject matter experts for these programs, and that workshop guide is on the right side of the screen. The remainder of the section outlines step-by-step instructions to implementing a COYL program in your community. This section provides best practices as well as resources to support implementation, including sample social media posts, template flyers, measurement and evaluation tools like attendance templates, surveys, and more. And here are just a few flyers from some of our partnered COYL events hosted during 2023. Some of those are made by our partners and other ones are utilizing those templates. And these are some photos from those workshops. These are in collaboration with those mayor's wellness campaigns, but it also includes partner organizations like healthcare systems or community living rooms like senior centers, libraries, and faith spaces. Our most popular workshops include our interactive ones, such as a Before I Die community vision board, Go Wish game afternoons, and moving screenings of A Man Called Otto. That was the most popular one last year. Our workshops allow for adjustments depending on where you are, who your audience is, what kind of resources you have available, and who you're talking to. The tree in the center there was done at a health fair and was a great way to get people talking about what they do want and how these priorities can impact their wishes for care. So whether it's about traveling, wanting to live in their own home, or other things, we were able to see what were priorities for people. When watching A Man Called Otto, it touches on wishes for care and how we can communicate those wishes to those who matter most to us. I also really enjoy that film because it highlights how these wishes and even our proxy can change as life moves forward. So each of these workshops also has a template available that can be used to guide you through planning and implementation. And using films, books, and games to make advanced care planning more accessible and understandable is really a cornerstone of COYL. And in the fourth section, we outline strategies for raising awareness about COYL. We highly recommend planning around key dates such as National Healthcare Decisions Day on April 16th, which is coming up, and National Hospice and Palliative Care Month in November. There are several resources in this section, including an advanced care planning presentation created by the Chatham Mayor's Wellness Campaign team that they were able to share with their residents on the importance of advanced care planning in honor of National Healthcare Decisions Day. And furthermore, we have several webinars available on our website that cover these topics that can be screened to residents as well. And this includes things like workplace wellness, living with Alzheimer's for caregivers, and a veterans-focused presentation. And then we also Sorry, my headset turned off for some reason. Thank you. We have designed educational resources that can be shared with residents digitally or as printouts. The first is our community messaging tool, which we encourage you to use to spread awareness and empower residents or community members. In it, you'll find a timeline of themed events and images that can be used on social media, in newsletter blurbs, and instructions on adding resources to your website. And we really wanted it to be as simple as possible. So it's a simple copy and paste or downloading of the images. And you can see some of our example posts on the slide. They're meant to be easy for you to utilize by saving the images and posting them with their complimentary blurb. And then another resource we created are COYL bookmarks, which highlight the basics of COYL, as well as link to our Book of the Month Club for suggested reading for books. So this Book of the Month Club is actually part of our media series, which you can see on the screen, and they can be used on social media to stir up conversation. You can do it to actually host like a book or movie discussion club in your community, or as just a handout to have available in those community living rooms, or creating like a COYL conversation starter kit. And I'm just going to highlight a few of our successes in 2023 with COYL based off of participant feedback. As I stated earlier in section 3 of our toolkit, we have strategies for evaluation, and that also includes a link to a Survey Monkey that we ask participants to fill out at the end of a workshop. This is available digitally through Survey Monkey, but I've also made printable versions just in case, like based off of accessibility. And we encourage partners to use these surveys so we can track the effectiveness of these workshops and make improvements with participant feedbacks. So we found that most participants found the materials and workshops provided as useful, and then participants overwhelmingly planned to complete an advanced directive. And then we also found that quite a few people already had an advanced directive in place, but we want to make sure we're still sharing with them because sometimes we don't know if we should update it and all sorts of things. And then as a result of participating in this workshop, most participants have increased their confidence in initiating the conversation with others and share that they plan to initiate this conversation with those who matter most to them. And so these two results really indicate to me that our workshops and resources are reaching our goal for COYL and being effective at getting people to at least talk about their wishes with those who matter most to them. And then I just wanted to share like really the bulk of how we reach communities. This is really with our COYL partners, and those are individuals or organizations that have a vested interest in raising awareness and education about the value of advanced care planning and healthy aging. So these partners range from being subject matter experts as speakers or organizers, marketing individuals, volunteers, host sites, even sponsors for events. And in total, we actually have 70 COYL partners at this time throughout the state, which 33 of them are willing to be speakers at different workshops. And we have 17 partners and 15 community Mayor's Wellness communities that are willing to be hosts for these workshops throughout the state. We are seeking more social workers, healthcare professionals, attorneys, and other subject matter experts to lead workshops. So if you are interested in partnering us, you can scan that QR code, but I'm going to flip to the next slide, but it'll be in our COYL resources section in the Google Drive. And this is just ways that we can help you. So this is how we can help you implement and utilize the COYL toolkit in your community. So we're here to assist by providing technical assistance to integrate COYL into your community and Mayor's Wellness Campaign, educating community leaders about the importance of COYL. So that could be me coming out and doing a presentation and sharing with them about it and a quick overview of the toolkit, and then connecting you to COYL advocates who can champion healthy aging, and connecting you to subject matter experts for that community programming, as well as providing tools and resources that can support your efforts related to COYL. And I know that was a ton of information, but at this time, if you have any questions, feel free to type them in the chat box or just unmute your microphone. But thank you for listening.
Great presentation.
Thank you so much.
Hi, Katie.
Hi,
Thank
Divya.
you. Great presentation. I echo that. I was wondering, in your evaluations, did you see that any particular strategy worked, I mean, best with the participants? Like you spoke about how lack of trust is like one of the main reasons. Was there any particular strategy? Like you spoke about films, you spoke about, so what helped the most? Was there any feedback on that?
Specifically, we didn't get any comments about that, but when I am there anecdotally, I found that when we were creating like conversation about people feeling like less alone about talking about this topic and talking about it with their neighbors and even practicing having those conversations seemed to be really impactful on people feeling up to doing so. But I think that's a really smart data point to look into. So I might be able to just add that to our survey questions. So thank you, Divya. And I also just put my information up on the screen. You can feel free to reach out to me at any time if you're interested in learning more, want to partner with us in any way, and or just want to use our resources moving forward. You could just grab them from our website or our partner uh, resources that were shared to the summit. And that is a great question, which honestly predates me, and I don't have the greatest response to that, but I appreciate it. Since it was created in 2014, I wasn't here at the time at the Quality Institute, but I believe it's just it's really just a conversation that discusses what is important to you in your entire lifetime. So I think that's kind of why they may have went for that. But great question, Kylie. One that I'm going to have to find the actual answer to. If there aren't any questions, oh, I will stick around here, but I also encourage you if you need a bio break to run to the bathroom, grab some water, happy to encourage you to do so.
Yeah, and that's a good point for us as well to include that in the program. Uh,
So, yeah.
so if there are no other questions, I would just like to make a comment. You said that the program started in 2014, specifically this, and from 2016 onwards, Medicare started reimbursing providers for um, conducting advanced care planning conversations. So did you see, I mean, maybe it's not, I mean, did you see a shift? Like, because there is always a supply and a demand, to put it
Mhm.
very crudely. So like now now that the providers are getting reimbursed, they may also be more interested in engaging in those conversations. Did you see any trend or
Yeah, so actually, I know in 2019 we did a Health Matters poll, and we found that although providers can be reimbursed for having those end of life consultations with patients, only about 24% of people were actually talking to a doctor or healthcare provider about their wishes. So, one of the things we do encourage, especially in our informational presentations, is one, informing them about that access, like being able to have a separate sorry patient meeting or about this topic, but also, yeah, just that informational part and then encouraging them to talk to their doctors. So we are hoping that our programming or increasing awareness about this is having an impact. But we found in 2019, just a few years after that Medicaid reimbursement part, um, that it was being very underutilized. I think with that, I'm going to stop sharing my screen. But thank you again, everybody. I appreciate it. And I'm around for any questions until we're all set. Thank you.
Katie, I was also wondering, like, was it like all the terminologies, like, like living will, power of attorney, or, what's the difference between an advanced care planning and a post human? I mean, there was some mention of it in one of your slides. Was it, I mean, what about the awareness levels among older adults in the community? Do you see that these workshops really help?
Yeah, I find that depending on which workshop that we do, um, we we do inform them on like what the different types of advanced directives are and how they would be utilized a little bit differently. But we also put in the toolkit just for those that are unfamiliar with this terminology, what they are and what the most common ones are and linking to them. So I know that there's often a lot of confusion at the beginning of our presentations of like, well, do I need a living will? And then do I also need a 5 wishes? Or can I have just a pulse? So a lot of those questions do come up, and we tend to just kind of inform them on like what the differences are and how they're also very similar, and that you don't need like 7 different living wills, and that 5 wishes is like kind of like even just a big combination of it. And also even telling them about the difference between like living will, which is more like a suggestion or a roadmap, right, for your proxy and your doctor, while like the pulse is an actual like a prescription that says this is exactly what you have to do, a medical order. So I find that a lot of times they're surprised, like that one's a medical order and one is just that roadmap. Yeah. Thank you.
Thank you.
Yeah.
We have 1 more minute if we have other questions or comments.
Mhm.
Thank you so much, Katie. I
Yeah.
mean, I'll definitely be looking at the toolkit. It sounds very interesting and very useful. Thank you so
Thank you.
much for this session.
Yeah, thank you so much, Divya. And thank you for your great questions. And again, feel free, anybody in the chat, to reach out to me, and I'm excited to work with you all in the future.